So now the stretch we're going to look at is going to be a stretch for piriformis. The piriformis stretch, again, is looking at muscles that are getting tight with the rotation of the pelvis. And piriformis is a key one. So the stretch for the piriformis is going to have your client lying on the ground, on their back, a comfortable position. The knees are going to be bent. So the side that we're looking at stretching, we're going to bring that leg up. So looking at stretching our left side and bringing our foot across the knee. So now with this, what you want to do is the knee that's with the foot on the ground, is what you're going to do is you're going to bring that up towards your chest and looking at holding that position. Now what you can do with this is with your arm is you can rotate that knee out to further intensify that stretch as it targets that piriformis. Once you're in that comfortable position, you want to hold that stretch for 30 seconds. And once you've held that for 30 seconds, you're going to take a break for 30 seconds, and then you're going to do the stretch again. So demonstrating the exercise, getting your client to run through the exercise of the stretch for the piriformis. Again, they're lying on their back, knees are both bent up. So the side that we're looking at stretching is going to be the left side. So we're going to bring that left foot up and rest it on top of the right knee. So for this position here, now we're going to reach up, we're going to bring this right knee towards, looking for the stretch through the piriformis. Now if that's a good enough stretch, you can hold that stretch for 30 seconds, or you can use your forearm and rotating that knee out to further intensify the stretch in the piriformis. You feel that? Once you feel that good stretch position, that's where they want to maintain that. It's not painful, it's a good stretch. You're going to hold that for 30 seconds. Once you've held that for 30 seconds, you're going to take a break, and then take a break for 30 seconds, and then you're going to do that stretch again. As I mentioned, you're going to do that stretch twice a day, and a stretch you could do every day. So now we're looking at an exercise for strengthening of the gluteus medius, which is helping with the innominate bone rotation. So the exercise we're going to be doing is a leg abduction. And for this, we're going to be using gravity as our resistance. So on a comfortable position, either on the floor or on the bed, you're going to be resting on your elbow, which is going to be provided support. The legs are going to be out straight. And what you're doing is we're focusing on the leg that's on top as you're lying on your side. So this is going to be the right side that we're going to be focused on. So the leg abduction is going to be an active movement where we're just bringing the leg up and then bringing it back down. Bring it up for the contraction for 2 and back down for 2. So this exercise, again, focus on that leg abduction, focusing on the glute med. We want to do that for a set of 10. We're taking a break, 30 seconds, and we're going to do 3 sets of 10 repetitions. So as you're instructing your client to do the leg abduction for the strengthening of glute med, they're on their side, again, either on the mat on the ground or on their bed, a comfortable position. They're resting on their elbow. Their legs are straight, and we're focusing on the top leg as they're lying on their side. So again, focusing on this right leg. So keeping that right leg straight, what we want to do is we want to bring that leg up for a count of 2 and down for 2. And as you bring the leg up, you're going to feel that muscle contract in that glute med in that lateral hip area, and you know that that's going to be the position where you're going to stop that movement. And it's a good smooth movement up for 2 and down for 2. You want to be looking at doing 10 repetitions. How's that feeling? Good. 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 5 more. 4 more. So again, you want to maintain that smooth movement all the way through, ensuring the full range of motion. And 1 more. Good, so once you've done a set of 10 and that feels okay, good. You want to take a break for 30 seconds. After a 30-second break, you're going to do your next set. You're going to do 3 sets, 10 repetitions. This is something you're going to do once a day, and you're going to do this every other day.